Thank you very much, Hani. Thank you for agreeing to moderate this session. First and foremost, I want to wish everyone yang beragama Islam selamat berpuasa. Okay, and welcome to this series of Future of Work webinars organized by IMU. All right, when we looked at the future of work, we realized that work is changing in many different directions. So we decided to call this and have this series of webinars where we bring in experts, bring in their this set of discussions, their thoughts on how work is being transformed in this era of Industrial Revolution 4.0. Today, we have 4 speakers being moderated by Hani, and the topic of today's talk is about the revolution of modern healthcare. And our 4 speakers represent the gamut of healthcare. We've got representatives from the hospital, from wellness, from caregivers, okay, as well as from telemedicine. So without any further ado, I want to welcome all of you warmly. I want to thank my team for helping me organize this as well. They're my backbone and I can't do without them, both Doreen and Najwa. Say hi, Doreen, Najwa, wave your hand. Okay, and
Hello, thank you.
I pass this back to Hani, who will moderate this. Thank you, Hani.
Thank you, Dr. Khan, for a warm welcome, and equally as excited with IMU team today. I'm here to moderate this session for this morning. So the topic of our discussion today talks about future of work, and we're going to explore a few models of the future for healthcare providers in the areas of feasibility, appropriateness, and barriers to implementation in the Malaysian context, and what it means to academic institutions and students who want to understand more about this industry. Ariza, would you like to start off our conversation today? A little bit of introduction about yourself, if there's anything that I've missed out, and perhaps share with us, your perspective on the revolution of modern healthcare and what shall we look forward to for the next a few years to come. Can I invite you to start off our discussion today?
So let me just give you a little bit of a brief of who we are. Now, KPJ Healthcare, so I think it's a household brand name with fellow Malaysians, yeah? So we have a network of 28 hospitals throughout the country. So by far, we are the largest private healthcare provider in Malaysia in terms of number of beds, number of consultants, number of healthcare and allied healthcare workers. So when we talk about the modern healthcare, so what do we envision? So I think, I think it's important for us to put that into context first. So people like you and me, when we talk about this kind of revolution, what we're expecting in the future is perhaps, a population that is healthier. Now, a population that is more focused on wellness. So we've got my fellow panels here who are of course, in the wellness sphere. And now a population that's perhaps more focused towards preventive care. Now, of course, the advancement of research, development and technology has allowed us to actually focus more on the data analytics that allows us to do this. Now, in the future, I think what we also envision is for ourselves, personalized health plans. Now, I think what we are already now experiencing since the pandemic is, seamless. So if you want to get healthcare advisory, for example, you expect to get it in the comforts of your own home. You expect to get medicine delivered to your home. So that's what now that's what's happening today. So actually the transformation of modern healthcare is already happening as we speak. Yeah, but of course, the last thing that you want to envision is again back to the basics of a healthy population, and all of us now more focused on our own well-being. So as a private healthcare operator like ourselves now, this is of course a trend that is not just today. So this is a trend that we see has been unfolding with the developments of technology, the usage of big data and analytics. So focus today really, if in the past, the focus of a private hospital operator like ourselves to build large tertiary level hospitals that focuses on acute care. Now today, our business model will be different. Yeah, so we are envisioning ourselves to be more consumer centric. So therefore, what it means is, we've got to be very attuned to what the consumer or the patients want. So generally, of course, a lot of this development have been accelerated because of the pandemic. Now, if in the past, you would never have heard doctor consultants or even ourselves going online to do telehealth consultation virtually. That's something that was unheard of. Now, but when you don't have access to the facility, so suddenly that becomes the new norm. So that is how KPJ sees our direction as well. We expect that we're going to be more consumer centric. So definitely we'll be closer to the community. We will be enabling a lot of our digital platform on telehealth, on telemedicine. We anticipate that we're going to be setting up ambulatory care centers now closer to the community. So, it's within your community lifestyle commercial compound. So what you're looking at is giving that care towards patients without them having to go to a tertiary level hospital if they don't have to. So if they need to get their regular screening done, blood work, lab work done, or simple procedures, then they can proceed to this ambulatory care center that is within the setup of the community. So that's how the business model will shift. Now, of course, for all this to happen, for this a wonderful medical revolution of healthcare system to happen, I think KPJ, I think we have always had this vision even from the very beginning. So investment in people. Investment in people is going to be very key because traditionally people who has been in the healthcare line, doc, please don't get offended. The doctors in this webinar, please don't get offended. But you have been traditionally trained, yeah, to do certain to use certain procedures, or to use certain medical equipment in certain ways. So you're so used to having a patient right in front of you so that you'll be able to feel, to touch, etc. But today I think the investment in our people, in our allied healthcare workers, in upgrading the knowledge of these people is going to be key. Now for KPJ Healthcare, I think there's not been enough said about our KPJ University College. Now KPJ University College is in fact the only medical private institution in the country that offers MQA accredited postgrad medical specialist degree. So see, Dr. Jasmine, there's a doctor nowadays are trained more holistically, I guess. Yes. So again, I think it is this concept of continuous improvement, continuous upgrade of skills as well as knowledge. So I think this is obviously going to be the future of modern healthcare. So for KPJ, we're already there. So, we are now just accelerating that move, and very soon, KPJUC will become a full-fledged university.
So, I mean, on the topic of modern healthcare and everything, what we have done post 2015, so when we started, is very much elderly care, palliative care, and things that is very difficult for a normal maid or normal non-trained caregiver to do. We go in and support that. Moving beyond that, what we have also put together is we have already built an ecosystem where we want to protect everyone. So as a platform, we also provide insurance for both sides. So nurses or medical practitioners that do freelance are now also protected when they go under our platform. So we provide insurance. We work with Great Eastern for that one. Great Eastern, yes, we work with Great Eastern for that one. There's a few partners. We work with Great Eastern for that one. They are very supportive for quite a while. We also have started providing products so that the freelancers don't have to worry about where to find gauzes, bandages, gloves, masks, and the care seekers don't have to worry about whether the products are fake or real, and so on and so forth. So we also do that. And then beyond that, we actually also provide a lot of training. Now, the training bit, we do more in Singapore. We don't do so. We are starting to ramp it up in Malaysia, but we have done a lot more in Singapore. So in Singapore, we are certified by the government, like AIC. We work with NTUC. We work with quite a fair amount of training partners to provide training. And why I say that in regards to the future modern healthcare is because we as a marketplace and a platform, we believe that everybody that is able can be a caregiver, right? You don't have to be trained as a nurse or a doctor or a therapist or a physiotherapist, and you don't have to hold a certificate to be a caregiver. Caregivers can run the range of really taking elderly all the way. Give an example. Can you hear me?
Okay. Yep. Good now. Good now.
Hello.
Yeah, we missed you for a
So
second.
okay, no worries. So the reason I brought in the ecosystem is because I want to share an example of what I mean by that. Back in 2020, down in Singapore, a lot of the taxi drivers basically ran out of customers, like in that sense. They were struggling. So what we did was, we are also a how do you call it? We are a contract partner with a National Kidney Foundation down in Singapore, and also we are a contract partner with Free Seniors, one of the larger dialysis centers down in Singapore. So what happened was, we partnered with the Taxi Association. We provided training to the taxi cab drivers to become a medical escort for dialysis patients to the centers. So it basically puts into action when we say the ecosystem. A person that drives a cab or a taxi driver, right? We upskill them with necessary knowledge and necessary skills to become a basic medical escort, just sending dialysis patients to the clinics, and then basically they get extra income, and we provide them jobs.
How we actually formulate our entire business is based upon an employee health benefits portal, right, or a platform itself. So what we first do is that first we need to be able to provide good value to our corporates, identifying some of the needs that they want, because in many cases, people talk about how they want to improve healthcare. But before we even talk about improving healthcare, the most important thing is, how do we manage healthcare, right? If you have a healthcare scheme, healthcare policy within the company itself, it's really, really hard to be liaising with thousands and thousands of different providers across the nation itself. So what you need to do is that you need somewhat of a similar platform to a HR system, right? You know, when you have a HR system, even for IMU as well, you go to a HR system, you click on your leave applications and stuff like that, it needs to be as systematic as that, right? So first things first, we look from a perspective of how do we manage for corporates. Then from that perspective, we then identify in terms of how do they actually have a certain expenditure where whether the expenditure is on acute care or long-term care in this case as well. And when we're able to dissect even further as well, that's really when do we work with different partners, right? How do we improve healthcare? Because no point for us to talk about health talks. If you talk about health talks on diabetes and hypertension to a group that are 20 plus, 25, or even 30 as an average age itself, you're not talking to the right people. They may be thinking like, oh, maybe my parents have it, my grandfather or my grandmother has it, but it does not actually address the core of the problem itself, right? It does not actually address the core of the problem. So when we actually help them to manage and also to help them measure some of the analytics in this case, right? That's when we actually work with different partners, hospital partners, wellness providers in this case, to be addressing very specifically into problems that are associated with the company itself. So we take it as a flywheel, if you want to call it some sort, right? Because once you improve healthcare, you're able to see it on the data itself to see whether the healthcare of the company is actually improving from that perspective, right? So that's essentially what we do. But we cannot operate it without the partners itself, whether it's physical partners, whether it's digital partners. In this case, physical partners is very, very important, especially the access, right? We talk about 7,000 plus private GPs around Malaysia itself. But the thing is, when this 7,000 plus GPs in this case, right, when they refer, where they're referring to, right? Are they referring to the right specialists at the right hospitals in this case? Whether they are giving it as just a referral letter, or rather they are directing them to a specific area in this case, so that they can actually get the right care in this case, right? So that's really something that we have been doing for the last 20, 40 years in this case, right? But with the emergence of internet, right? With the emergence of, not really emergence of internet, but the emergence of digital healthcare service providers, right? Right? So we move towards an era of telemedicine. So some of my friends asked like, okay, so can you sum what telemedicine is? I just told them it's a healthcare provider on Zoom. Okay, maybe we don't call Zoom, we just call a video call, right? So it's essentially that, but the structure of telemedicine in terms of what they have, in terms of information, in terms of how they actually do a post-care in this case is very, very important. It's the doctor itself or the pharmacist or even the psychologist in this case, 80% of the consultation itself. But people don't think about the 20%. Why people don't do it through Zoom or WhatsApp call or video in this case is because the infrastructure that's supporting the doctor or supporting healthcare profession is not there, right? Because if someone comes in and it's just going to be like, oh, how's what you've been taking for the last 5 years and stuff like that. Those kind of angle is good, but it's redundant. People is half sick on the bed itself. And when you are really, really feeling ill and you're on the bed, the last thing you want to go is to walk to a physical clinic, get treatment over there, right? So of course it helps with, making sure that there isn't fraud and things like that. But for every 1% fraud, that 99% are genuine cases, right? So from that perspective, right, how do we bring digital healthcare, whether it's telemedicine, whether it's pharmacy, delivering drugs to your doorstep in this case, right? How do we bring this access of services closer to the patient? So if I just throw it back to you, Honey, in this case, right? What do you see the benefit of digital to healthcare?
What else can students look forward to that they have to pick up like fairly quickly on top of everything else that they have to learn moving forward?
Sure. Just going back to your point about medical being seen as a conservative kind of industry, right? Yes, the perception is there. The perception that, financial services or even healthcare in this case moves at a slower pace compared to things like retail. In this case, right? You talk about Shopee, you talk about Lazada and things like that, where they brought e-commerce to, retail to electronic platforms a lot quicker as well. Now, there is a pros and cons towards moving digital. Number one, you need to move in a very controlled manner, because when we talk about data transfer into platforms as well, you need to know that the platform is pretty robust from a data standpoint.
Right.
Right.
So they need to know.
Yes, they do need to know, and even these people for IT teams within whether it's medical institutions or even healthcare providers as well.
Sure.
IT teams need to drive the security a lot further, and in fact, they start looking into innovative solutions like how do we get this solution in, but still making sure that the security is controlled, is measured properly. Right.
Understand.
So the next part is really about every single industries, there are people that is driving innovation. The fact that I'm sharing the panel session with all of you today is also to show that innovation is moving towards a certain pace. Now, for people who are joining the workforce, in this case, now, question is whether you want to join a very stable, a stable and a proven industry where you go into physical, you go into even looking into care and things like that. There is no wrong to that. But the other spectrum, which is a more risky in the sense that it's unproven business model, it's things that people want to push the envelope even further, things like telemedicine as well. There are many different telemedicine providers that have been in the market for 4 or 5 years. But because COVID came, they became well-known, right? So people see the tip of the iceberg, right? But they don't see the last 4 or 5 years of slogging it out, right?
Yeah, because they don't see, they see what is being presented in front of them, yeah, Max?
Yeah, in fact, I think what's important is also, I think one of the participant today was just messaging me on Zoom today, saying that insurance won't cover online consultation. Now, yes and no. Insurance are beginning to cover for online consultations, but now the approach to how online consultations are being conducted is quite different. One, certain payers sees digital healthcare as a value-added service, right? So it's like a good to have. But if you talk about on a holistic basis, right, how do we fit digital healthcare as part of the holistic health experience? Primary care, how is primary care more accessible? It's by having a digital channel to that. But if things that digital channel cannot address, you move it back to the physical brick and mortar for primary care. In this case, that's really when you start doing the referrals upwards. Things that are,
yeah, so Max, sounds like a lot of lobbying at the same time, you know, to get everybody on a same page, right?
Yes. Lobby in this case, it can come in different ways. You can do an economics model, because both business talks about how can it help with my bottom line or my top line in this case.
Sure.
So if you provide a good business model, they would take it up in this case.
Of course.
So I guess I will not hog too much of the space as well. But yes, this is really what we see as, I think, the future of work. Healthcare or not, certain core skills need to be there.
The modern healthcare is revolutionizing, okay, or it start to change dramatically, okay, but there's still certain things that are still valid, okay, despite the changes, right? So what we can do basically is, first of all, is to accept the changes and also to embrace the changes. Right? We decided to make quick changes and we move online, digital, but it takes us 3 months to go through that, right?
Wow.
From convincing people to, like switch to online if you cannot come here. So, despite the digital changes, the modern, the revolutionization of modern healthcare. So the importance of people skill, okay? So meaning communicating, conveying the right message, inspiring people, motivating people, as well as yourself being a very goal-oriented person, right? The follow-up service that you given to the client, the patient, is very, very important, right? Even when you are online, right? So the third one is, of course, your medical skill, your physiotherapy skill, your dietitian skill, right? So, all your caregiver skill, right? All those things that actually it really matters, because when you talk about global digital, again, the whole is your competition, right? So And lastly, it's all about personalization. So like, how do you personalize? So when you meet one-to-one, you already have that personalization. You are actually customize your training, your therapy, right? Your sessions, based on what the client needs. What is your analytical data, right? Where we have, to my advice to the fresh grad, right, or those that are still undergrad, right? So to actually sharpen your skill in terms of utilizing various data. So very important for the undergraduate to learn how to use this data, because the data is so easily understand nowadays. It's very simplified. It can be used by anyone, right? Anyone that can read or they can listen, they can use that. And why not us? If you can't use it yourself, then you can't actually integrate for people. Example, you get a health screen report from KPJ. So how do you use that, like information to provide a full integrated rehab program to people, or to providing them improvement in healthcare or even lifestyle as well. So how do you use that data, right? So coming towards this data, so how do you make sure that that the program that you have currently to combine together and to deliver the goals, the result to the people? Yeah. So yeah, exactly. Let me add a few more for what you said just now. So you said translating the data from a cold data to a warm message, right? So this is all about inspiration. Yeah. So you have to warm people up. Like you do exercise, you have to warm up. So you have to warm people's brain as well.
I like that.
Yeah. So how do you transfer that data into something that can motivate them, that easy to understand, easy to relate to their life, and as well their goal, right, to achieve it. So once you're able to do that, then you can make sure that there can be in a prolonged program and progression so that they achieve it, or even in the prevention maintenance way, right? So the skill that is needed in the modernization is the utilizing the tools of the digital, right? First of all, right? So we are very good at your skill already. No worry, keep on be very good at your skill. Like there's certain, I always say this, right?
Correct, and it's called personal branding, yeah?
Yes,
it's called personal branding. So putting out what is good out there is not so much of advertising, but creating that trust, and especially in your segment of the market in healthcare, where it's heavily people oriented, because there's physical contact and all that. So what I'm also hearing is that communication skills is very important. So that hasn't changed, but we need to kind of elevate it more because of the use of data and the embrace of technology, more technology for the future. So in all things considered, moving forward, technology and all this, what will remain the same in your opinion? 10 years down the road, what will remain the same, despite the fact that there'll be healthcare changes?
Yeah. Okay, let me add on to the point, because I feel it's very interesting when you mention it, because for the communication part, you see, when we talk about digitalizing and expanding, multiply the way that they communicate, so it's all about organizing, right? So it's all about organizing. You don't put it too complicated for yourself. So organizing the information so that it can reach to your community in a systematic way and massively. So it's as simple as creating a own page group, all right, and just get people to join in and just give sharing, right? So I mean, you can't compete to all those like big company, right? They have a huge budget, right? They can beautify everything, right? But you can do something for your community, right? To highlight it is actually what we call the people skill in terms of like how do you ensure that the clients still benefit despite it's online. So like, how do you really dig them out? Okay, I would say dig them out, okay, so that they achieve their goal. So example, like people still have works, and going onwards, you have work from home, right? You
Yep.
can choose work from home, or you want to work
Sure.
from center, right?
Yeah.
So they are still facing a lot of like outside interruption, right?
Sure.
They have to take care of the children,
Yep,
right? You
yep.
see, so you don't you don't think like people work at home, they are free. They actually have to deal with children.
No.
Oh, yes.
No.
And
They're under a lot
they
of
had to
stress.
work like until night time, sometimes to answer. Yeah, I don't do that to my people here, right?
I hope
Just-
not.
no, okay. Yeah, so how do we keep them motivated?
Right,
At
right.
the same time. So you see,
Yes,
the
yes.
challenge is double actually in terms of
Yeah.
people's skill. So
Yeah.
you have to, very simple,
People's
double the people's skill that you can deliver to the people, right? So
Excellent.
instead of like, too much medical knowledge,
Yeah,
skill, too complicated thing, right?
Sure.
So the key is to simplify the data, the information, or the things that you want to say, make it interesting. Like example, like, try to find out like, okay, how is their day, how is their energy, so that you can see
Right.
what is their capacity,
Yeah,
right?
yeah.
If they are like headache
Yeah.
already, don't give information,
Sure.
just
So
do
people
it.
skill.
Yeah.
So
all these
what
people
will
skill.
remain the same moving forward is still people skill.
Still
So
people
that will
skills.
remain.
Yes,
Okay.
and of
Thanks.
course the medical skills. Yes.
Sure. Thanks.